So today we have Julia, and we are going to be treating her necklace lines. We have done several rounds of PDO smooth threads, and she's had improvement, but she's still looking for a little bit more resolution in the smooth threads. And so we're going to go ahead and try and do a little bit of dermal filler directly into the necklace lines to help disguise the appearance of those static creases in the neck. We just wiped off topical anesthesia. You can see she just has very reactive tissue. Even she's numbing here sort of in that nasolabial fold area, and you can tell she's incredibly red. This is just sort of standard for her. But we did cleanse her skin and numb her, and that's why you can see a lot of that redness. So we're going to go ahead and get started here. So she should be fairly comfortable because she's been numbed. And the product that we're using today is RHA Redensity, or Revance Redensity. And this is a product that we can place incredibly superficially, so that's why it's great for an area such as the necklace lines, because we just want to be in that superficial tissue to fill in those creases. So you can see like how superficial you can get with this product. You don't have to worry about Tyndall effect or anything like that. And we're just sort of marching along here, one retrograde thread after another, aspirating every time. Doing okay? So as I discussed, we like to do PDO smooth threads into the necklace lines. It's a nice gradual treatment option. It gives you nice gradual results because, as you know, we don't stimulate collagen overnight. And so filler is a nice option for immediate results. Like I said, she's done several treatments and she has had improvement, but she's looking for a little bit more of that instant result. And so that's why we elected to do some filler at this appointment instead of another round of smooth threads. Are you comfortable, Julia?
Yeah, really comfortable.
Okay, good. So we're just going directly into these necklace lines, like I said, really superficially tenting so I can appreciate my depth, aspirating, and then laying retrograde thread of material. This area can appear lumpy a little bit initially, and we'll smooth it out nicely. I did actually think the product is laying really nicely, but some other products I've used, they can appear a little bit lumpy. And so, once we're done, we'll put on some arnica gel and just give her a nice little massage to make sure that it looks nice and smooth and integrated into the tissue. But already I think it's looking awesome. So if you're paying very close attention, you might be able to tell that we have switched ejectors for this bottom line here. At the AAFE Training Center, we are always looking for a teachable moment. And in this particular case, we have a new nurse on our team. And so she is treating the bottom tech neck crease. And so you can see she's taken wonderful notes. She has placed the needle very superficially in the tissue, tenting once she got all the way to the hub to make sure that her depth looked good. Aspiration looked good, and then she went for that slow retrograde injection. So we're placing product as we exit in just a very slow, steady manner so that we get nice distribution of product in that static crease. And so she's basically performing the same exact technique that I was doing in that top line. And if you look at the top line, you can already appreciate a little bit of improvement. Unfortunately, she experiences that erythema from the topical anesthesia, but you can tell that's starting to settle down a little bit. And already that crease has softened some, which is really encouraging to see that she's already getting some response just by placing that filler directly in there. Again, she's done several treatments of PDO threads, and she was looking more for a bit of an instant improvement. And so here we are placing dermal filler, and she's getting just that. So again, you can see Elizabeth is just placing that filler really very superficially within the tissue to fill in those creases, and she's doing a fabulous job. We do teach tech neck treatment regarding dermal filler in our level 3 dermal filler course. So if you're interested in adding this skill to your tool belt, then definitely you should see yourself in a level 3 AAFE filler course, so that way you can offer this procedure to your patients as well. And it goes really lovely with a combination of PDO threads is the dermal filler technique. The dermal filler generally gives you, depending on the filler that you're using, 6 to 9 months of improvement. And we all know that that PDO thread stimulates collagen at its peak between 3 and 6 months. So really, as your filler is sort of metabolizing out, our threads are just starting to work. And so it gives us a little bit more longevity when we use them in combination. So this is a great case to learn from, because this patient has had a little bit of both in the past, and now today we're doing filler. So I think she'll be really, really happy with these results once, of course, all of her injection sites heal and the redness goes down. So things are looking pretty good so far. Okay, so we have just finished filling these necklace lines, or tech neck, whatever you like to call them. And again, we just went directly into the lines, the creases, and put in some Redensity, which is Revance product filler. And it looks really nice. Obviously it's red, but as we discussed in the beginning, she just tends to have really reactive skin, and this is very typical for her, and it'll calm down sort of as the day goes along. But I'm pretty happy with the results, so we'll see her back in 2 weeks and reassess at that point.
Yeah, no, it definitely looks a lot softer.
Good.
Yeah, thank you so much.